Welcome to the next episode of Roots to Health. I'm your host, Dr. Craig Keever, and my lovely compatriot, however you say that, compatriot, lovely wife, and vegan chef.
That's
Amy
right.
Keever. And we're here to talk today about a topic that actually I think we may have done one similar to this recently, but this is, I think, a slightly different slant.
Can't talk about it in one sitting.
Not one sitting, and really I think we can't talk about it enough.
That's
because it's such an important deal.
It's the basis, really,
It's
of
kind
all
of
of
a
it.
basis of all of this. And the topic is plants versus pain, how plant nutrition fights chronic inflammation. So, basically, the differences, I think, to first describe are between chronic pain and acute or inflammation, chronic inflammation versus acute inflammation. Of course, acute inflammation deals with an acute injury, something that happens, and now we got some inflammation immediate. Yeah. Versus the chronic, which can be very subtle, low grade, typically at first, pain issues, but that just don't seem to go away. That either
And hard to nail down.
They're hard to nail down. They can be very subtle, and then become not so subtle.
Yes. I can speak from experience.
Yes. So, I don't have any immediate statistics available, but certainly, chronic inflammation is affecting more and more people, and we'll get into some of the reasons for that here in a little bit. And that feeds into other issues like, seeking pain relief and opioid addiction on one end of the extreme.
Right.
And on the other end of the pain relief situation is taking too much Tylenol or ibuprofen, as a relatively minor way that we have of taking care of something.
When you really have to fight and be an advocate of your own health, because when I was going through all this pain, I don't know why I kept them, but I kept asking a doctor who kept giving all kinds of various pain pills, and I would go home and read about it. I'm like, oh, I'm not doing that. And I just collected a whole bag full of them. And if I had not, really tried to be an advocate for that, I could have been on pain medicine for the rest of my life.
Sure, and I'm guessing they were all flavors of different types of pain medicine, from fairly benign to very addictive.
Right. Yeah. I mean, it spills into everything else.
Yeah, well, and to that end, I'll say it fairly regularly. I'm definitely an advocate of Western medicine. Sure. I was trained in Western medicine, but there are a lot of shortfalls of Western medicine, yes. And one of those shortfalls is the whole idea of a pill for every ill.
Right.
And doctors not taking enough time to sort through the history to figure out what is the root cause of the issue and how do we fix that. We may be able to put a Band-Aid over it and mask it, but unless you treat the root cause, it's going to still be there.
And you can't afford to go on autopilot with your food. You can't, we're learning so much that, I've been in this for a long time. You obviously as a physician have been into it much longer, but learning about nutrition, it's wow, there's always a revelation of okay, I didn't think about that being a problem.
I tell you, and again, as a student of Western medicine for a long time, doctors don't get trained in nutrition and what that can do for us.
Right. Nor, would you say that they're really even encouraged to have that mother? You've always said the mother is the historian of the family. So you really have naturally leaned that way. But I don't know that they're really trained to kind of assess that as far as, they kind of get into that problem solving in a different way.
It's very much a problem solving attitude of, here's the problem, I can fix that. Mm-hmm. Instead of digging deeper for what's the cause of that problem.
Right.
It's the acute desire to satisfy the patient's needs, and then to get onto another aspect of current medical faults is having to see so many patients
it's
so
understandable.
quickly.
That's right.
Yeah. It's a
There's not enough
difficult
time
chore.
to do it. Yeah.
So we digress. That's a completely different issue.
That's what we do here.
We do here, yes.
We don't want to make any apologies for that.
Yeah. So, but yeah, this issue of chronic inflammation really affects so many people and can create anywhere from just minor annoyances to severe debilitation.
And it's really highly with women. Women seem to be more prone to it than men, but it's happening for men as well.
Well, and not only that, but to kind of get to the underlying theme of why we're doing this, the standard American diet really feeds the flame.
Oh, for sure.
Of chronic inflammation.
For sure.
Yeah, and so we'll talk more about that in a minute. So, what are the kinds of issues that I'm directly addressing here? Heart disease, interestingly, is a problem of chronic inflammation.
Yeah.
Okay. Autoimmune diseases, diabetes, things that you might not necessarily think of initially as inflammatory per se.
I never knew like thyroid issues and type 2 that was all a type of an autoimmune issue, right? I mean,
absolutely, it certainly can have those components to it. Particularly
thyroid,
the
for
type,
sure.
Particularly the type 1 diabetes. Type 2 diabetes may not be as directly related to autoimmune issues because that's more related to insulin resistance and the content of the diet. Type 1 diabetes certainly is where your body has overreacted to the insulin producing cells in the pancreas and basically eliminates them.
Wow.
So, yeah, and not to mention neurodegenerative diseases, various like Alzheimer's and various forms of dementia. So, and of course, as we're alluding to, when we get to the place of having a position of chronic inflammation in our bodies, that situation then kind of creates a self-building, perpetuating problem because the nerves then become irritated.
Yeah.
And then that just builds on itself.
Yeah.
So these are all the reasons that this is a very important topic for these times.
Oh my gosh, yes.
Yeah. So why does diet matter in this case? I think, first of all, to kind of shamelessly self-promote, I'm giving a talk at the end of August.
Yeah, nothing to be shameful on that. I know what you're saying.
Through
but
the Bentonville Public Library Foundation and the Bentonville Public Library on the topic of food is medicine. And this is why diet matters so much, and what I was alluding to about getting to the root causes. When you can get to the root causes and fix that, it changes things dramatically.
It's incredible.
So, for instance, if you've followed us for a while, you know that I've had type 2 diabetes. And, one of the ways to historically fix that was, decrease your carbs. Increase your fat and protein.
Some people we've met have not had fruit in like a decade.
Right.
Because they're told not to eat fruit.
And anybody with diabetes knows of the old adage of, carbs are your enemy, basically, and
that sugar is to blame.
And that sugar is to blame. And sadly, that is absolutely nowhere near the truth.
We're not saying that sugar's good, but it's really not the primal.
Right. We've been through that in terms of the refined sugars are the problem, but the enemy is not carbs.
Right.
The complex carbs are the savior, really. It increases our insulin sensitivity.
Yeah.
So,
boy, are you the poster child for that?
And that's where I was going with this is, getting at the root cause. I was on 2 diabetes medicines, 2 blood pressure medicines, a cholesterol medicine, and lost then 100 pounds going to this way of eating, and then by continued tweaks, because it all doesn't just go away by that.
And this is what I want to say to people, I don't mean to interrupt you. I'm just saying, don't let those tweaks that you have to kind of keep don't let your food addiction start talking at that point, because you really could have gone, this isn't working for me. I'm going to have to. And it would have been a way to kind of soften things, and you just kept at it.
Yep.
And so that was really important.
Thank you. Yeah, that was real. It has been really important. And, my belief in the phrase "food is medicine."
You held that promise to yourself.
I've held that promise to myself, and the process of test and measure. I've gone for the last 2 years, having achieved some of my goals, not achieved the end goal, and so to that end, my blood sugars were a little higher than I wanted, just barely, kind of in the pre-diabetic range, I suppose you could say. And I want to have all my numbers down in the normal range, and I've been unable to lose the last 20 pounds to get to my quote unquote normal ideal weight.
Which isn't a vanity thing. That BMI is really important.
It is really important. And my whole issue with that for me has been, if I could have normal numbers, i.e. normal blood sugars, normal blood pressures, normal cholesterol, and be at whatever weight,
right.
I'm happy with that.
Right.
But I've proved to myself that concept that the BMI is important.
For sure.
It's not the be-all, end-all number to pay attention to, but it is a good piece of information. And
it's definitely showing that as you got it down, your body started just being able to handle things better.
I'm still not quite to the quote-unquote normal BMI, but I'm getting closer. I've in the last month or so, I made a few tweaks and eliminated a little more fat from my diet and some things that I kind of knew, but didn't pay as much attention to as I should have. Yeah, so I've rebooted and increased my exercise program a little bit and decreased the fat content, and lo and behold, I'm waking up with sugars in the low 100s.
And just as a side note, like it used to, if you had a high fat kind of, or more decadent meal, even if it was plant-based, you shot up for 2 weeks sometimes. Yep. We went on a bike ride yesterday and we had a decadent kind of plant-based meal, and your sugars did not react that way.
That's
so
right.
That
That's
is really,
exactly right.
really cool to see.
So in terms of the chronic inflammation then that we're talking about, trying to apply all of what we've just talked about to that issue, and something that we've watched with your chronic pain, as we've increased our omega-3 fatty acids.
It's been a game changer.
And decreased our omega-6 fatty acids. Yeah. It's really helping.
Yeah, and so that part of the processed foods, it's not just like that it's got oil in it so much as we have eliminated a lot of like unknowns, because there are a lot of things slipping into your food that you do not know, or
exactly.
We'll talk about that on the next podcast. But.
Well, and to that end, then what are the things that we really look at on not just a plant-based diet, but more specifically for chronic inflammation? We are looking in a big way at that omega-3 to omega-6 ratio.
Yeah.
Okay, that's a big player. Now, why is that a big player? We've talked a little bit about that in previous podcasts about, the omega-6 fatty acids are directly involved in our inflammatory response. It kind of turns it on.
Yeah.
All right, so it heats things up,
yes.
which is something that our bodies need. If you can't heat up your immune response, you're not going to have an effective one.
Right.
So omega-6s are a very important aspect of it. It's hard to pin down a precise number per se, but
you're not going to worry about getting enough omega-6s.
Right.
You will find them, even in the plant world. And not that nuts are a bad thing, but if you are inflammatory, you kind of need to pull off of those because their ratios are way off.
So the ratio that we're kind of looking for overall in a normal, healthy diet in a person with no inflammatory issues would be about 4 parts omega-6s to 1 part omega-3. Somewhere in that range, 2 to 5 parts.
Say that again.
2 to 5 parts of omega-6s to
omega-3s?
1 part to 1 part omega-3s. It is slanted a little heavier for a person without metabolic disease. Okay. Now, when you get into the aspect of healing somebody with chronic inflammatory disease, then you really probably want to flip that ratio.
Oh, big time.
That's yeah. So,
and I will link Dr. Brooke Goldner's. We have that short video where she really explains the pathways to where, because this is a lot to take in at once.
It is a lot.
But I'll link that below so you can have that as a reference.
Yeah. So and so what are the foods that are highest in omega-6s? The standard American diet.
Right. Everywhere.
Meat, dairy, and eggs.
Very.
And then we got to throw nuts in there because that's not on the standard American diet so much, but it is part of the plant-based world, and so it is something that you have to pay attention to. And I don't think Brooke would necessarily say to someone who's in a healed state of their chronic inflammatory disease
she has
that
them.
we have. Yeah.
But everybody, keep in mind, Dr. Goldner's process is she's working with everybody who's ill.
That's
everybody
right.
who's got some kind of inflammatory process going on. So a part of her, she has her Goodbye autoimmune protocol. She has her Goodbye lupus protocol. So one is more raw foods, the other one, and then there's hypernourishing, which is kind of a step down to both of those.
Yeah. So typically, as we've kind of mentioned, but I'll put it in a little briefer summary, the pro-inflammatory type of diet is high in processed foods, high in refined sugars, high in saturated fats, and as we mentioned, as a result of all that, high in the omega-6s.
Yes.
So contrasting that with the anti-inflammatory diet, which are going to be foods that are high in antioxidants, high in polyphenols, high in fiber, and high in phytonutrients.
Yeah.
These kinds of foods will lower a protein in the blood called a C-reactive protein, which is a protein that is one marker to use for how revved up our body is in terms of our inflammatory response. And it will lower other markers that are used to test in the bloodstream for that. And as mentioned, fiber is in there as one of the anti-inflammatories. Well, one of the reasons that
Can't do it without your fiber.
Can't do it without fiber, because one of the huge players in all of this is our gut lining, which we've had a talk on that, a podcast on that, that I'll remind people is one cell layer thick. Okay, so it's
micro.
very delicate.
Yes.
And it's surrounded by our gut microbiome, the trillions of germs that coexist with us.
Beautiful family.
A beautiful family that coexist with us, and it's a symbiotic relationship. You know, we provide them a safe place. Theoretically, we provide them the fiber they need, and they provide us a lot of things that help us heal.
Which makes a prebiotic more important than a probiotic.
That's right. So, and the problem is when we get a diet that's too high in saturated fats and all the Western diet things, then you get a much higher tendency towards a leaky gut.
Yeah.
And that will allow things access to the bloodstream that don't have any business having access to the bloodstream.
That so much.
And that revs up the autoimmune chronic inflammatory response.
The thing is, for lifestyle medicine, I've always said, you cannot get to the other things like good sleep and other not being stressed. You can't do it when your diet's so messed up.
That's exactly right.
But the empowering thing to me is to watch someone who had 15% left of their kidney or liver, function. And then Brooke flips the whole thing by her program, which you can do by using grocery store foods, and completely heals the body.
Oh.
So when it's firing up against and saying the autoimmune is going against your own organs, like that completely changes when you heal.
It does completely change. And Brooke Goldner's story is just one of the most remarkable I've heard.
Incredible.
You know, as a teenager having stage 4 lupus, being told that she had, her kidneys were dying.
Stage 4 kidney disease.
Stage 4 kidney disease. And finding this way of eating and tweaking it to her satisfaction with her understanding of what was going on, and now her body at the age of mid-40s, no markers of chronic inflammation, lupus, or anything.
Yeah.
She was told she would never bear children. She had 2 children. So I mean,
she was not expected to live through her 20s.
Right.
And she's helped thousands of people, and to those people who maybe they don't get full capacity of their kidneys or their liver, they're still able to live they get off the transplant list.
Yeah.
Y'all, come on.
Exactly.
I mean, that is that is amazing.
Yeah, it's
thousands
totally
of people
amazing.
She's helped.
Yeah, it's just an incredible way of living, and we could talk all day long and do about anecdotal cases,
Yeah.
okay? Brooke Goldner being an anecdotal
Right.
case. This is not a long-term research scientific project, okay?
Explain that to people that might not understand what that's really saying.
So yeah, I mean, so there's various levels of reasons to believe certain things, okay? Anecdotal evidence is probably one of the weakest in terms of...
Very true, but it's not research-based.
Right, that's right. You're right. I mean, it's like my anecdotal story.
Right.
Okay? I view that as a very powerful thing.
Right.
For me, I think it demonstrates the power of plant-based eating.
It was valid for you, but on paper it wasn't proven.
That's right.
Yeah.
Yeah. And so I would never in a million years tell somebody, look at my story and do what I do because this is what's right for everybody.
Right.
Because I am one anecdotal case. Okay.
But once you get thousands of those coming,
Yeah.
you do start to fall.
But having said that, anecdotal cases for me are things that like kind of raise my radar. And then it gives me something that I can hone in on and look at, well, what is the real science behind this?
And she is being involved with the Journal of Medicine
Yeah.
to do things like
And
that.
so, in terms of other things, the next levels up, you're talking about meta-analyses of
Double-blind, placebo.
direct experiments
Yes.
involving double-blind, placebo-controlled, randomized studies are the ultimate
Yeah.
way to filter out all of the variables
Not
and figure
studies
out.
paid for by someone who has an agenda.
There you go. And that's one of the things that's really a problem in this country because there's so much misinformation out there.
It's no wonder people are confused.
It's confusing, and the meat industry and the dairy industry and the egg industry and the refined sugar industry are
Yeah.
all trying to put out information that says, well, this science study says this. Oh, but the science study was funded by us, so
And
we
this
kind of paid
stuff,
the researchers
they're scared
to
of.
see.
Yeah, they're kind of scared of
Yeah.
it, so they kind of react to things like that. They want to come at it.
Well, and just like years ago when we finally figured out smoking's bad for you, it
Right.
causes cancer, and the tobacco industry did exactly that same thing. They tried to sweep it all under the rug, and they tried to provide science
Right.
that said, no, that's not true.
Right.
Smoking's good for you.
Which sounds crazy, but to us, as much as we've been in this, it's crazy what the standard diet is being said. To us,
yeah.
we're like it's the same thing.
Yep.
But it's just fed in people's everyday lives, and it's like they don't think anything about it.
Exactly.
So sad.
So the next segment, and this we're probably going to sound a little bit like a broken record on.
That's okay.
Because what are the key foods that are anti-inflammatory is the next little segment we need to talk about. And I would say probably the biggest one that contributes to this, of course, is
Greens.
green leafy vegetables. Dark green leafy vegetables to include kale, spinach, arugula, and you could go down the list. Swiss
And the more
chard.
I've seen, Brooke uses the greens, of course, but it's beside the omega-3s that you're supporting on the side. Those greens have, not only are they nutritionally dense, they have all those supportive elements that when you start saying, okay, what does it need? Folate, all this, all these different things,
That's right.
iron, it's all
all
there.
the phytonutrients,
Yeah, it's all
everything's there. Yeah, that's exactly right. And then to couple with the green leafy vegetables is going to be your omega-3 containing foods, which are primarily going to be chia seeds and flaxseed, and to a lesser extent, I think, walnuts.
And hemp.
And hemp, yeah. And hemp seeds, yeah. Very good, yeah. So what are some of the other tweaks that we use in our diet to improve our nutritional status that are anti-inflammatory? Well, berries, particularly darker berries. These have a lot of polyphenols and anthocyanins that
Just helping those free radicals.
That's right. That's exactly right. And really helps calm things down in that way. Turmeric or curcumin is a natural kind of pain reliever.
And anti-cancer.
And anti-cancer, yeah.
Although do listen to the next podcast.
Yes.
We've got a little news there.
We have
That's
a little news
teaser.
about that, yeah. Cruciferous vegetables, broccoli, Brussels sprouts, primarily have sulforaphane in them that has anti-cancer properties.
And broccoli sprouts are the very, very, very
Broccoli
highest.
sprouts are fabulous, yeah.
They're unbelievable.
And legumes, beans and lentils and things of that nature. Lots of fiber, and resistant starches to help with lower gut inflammation. And then, of course, various herbs and spices to include ginger and cinnamon and garlic and those kind of things. Those are all very good anti-inflammatory properties.
Dr. Greger talks about cloves as one of the highest as far as being able, because I got to where I was just kind of taking that in a supplement form myself. I would just grind it up myself and put it in.
Yeah. Absolutely. So, a brief little foray into what are some of the clinical evidence and whatnot towards all of this. There was a 2015 study done that demonstrated whole food plant-based diet reducing pain and improving function in rheumatoid arthritis patients. Physicians Committee on Responsible Medicine is doing ongoing research with plant-based diets and lowering the, as I mentioned before, the C-reactive protein, CRP, and tumor necrosis factor alpha, which is a cancer involved in cancer treatment.
Which, as one of their instructors, I have to say, that's a great place to find any kind of resources or any kind of Physicians Committee.
Yes, Physicians
Great
Committee,
resources.
yes. Patients with fibromyalgia reporting symptom relief with vegan diets. I mean, the anecdotal studies are abounding in the plant-based world. For anybody interested in taking a deeper dive into the clinical evidence, I would really point you to Dr. Michael Greger's website, nutritionfacts.org. He's got a wonderful YouTube page, I believe under the same name.
And he's really great because he kind of goes all over, just like Physicians Committee, but he has real short videos that if you're like you want to look up something specific that's not, where other people would be more about healing heart disease, he's really kind of overall, he's got so much information.
Yeah, I will tell you,
he's not backed by anybody.
Right.
He does everything, all of his funds that he gets from his book is donated to charity organizations, and research.
I mean, for me, hands down, he's the first source I go to when I'm thinking, I need to understand a scientific research article that shows me what is right in this situation.
Definitely.
Yeah, that's he's really high on my list. He really sticks to the science, and he's the one that most commonly says the whole phrase placebo-controlled, double random. Yeah, he's got that down to a nut.
And you won't know until you put it to the test.
Exactly. All right. So, practical tips on a brief basis for how to start incorporating, some of these anti-inflammatory foods. I mean, one of my favorites is a smoothie. I mean, that's so easy to get a bunch of greens and a bunch of these anti-inflammatory foods.
For sure.
And so tasty.
Yes.
And you can sweeten it with dates and... Holy moly, it's like you never even know you're drinking vegetables.
Put those flax and chia in there.
And flax and chia, yep. Other foods to include chickpeas and turmeric, and as we mentioned, greens, salads. We do eat salads as vegans.
They're big, bulky salads.
They're big, bulky salads, very dense with all kinds of wonderful eat the rainbow kind of things. But yeah, I mean, the salads really do participate in. I would say, how many salads a week do you think we eat like that? 2 or 3?
We get on a kick, and we do them a couple times a week, and then we don't do them for weeks.
Yeah. So, in closing, this has been a really good topic for me. We've covered this very nicely, I think. I just want to re-emphasize the whole concept of the standard American diet is just so full of holes and problems, and it's killing this country.
It is killing
It literally
this country.
is, and
it's very serious. I mean, like we are we have the most resources and we are the most deprived as far as our health. That there's so much money being put into the medical, part of this, but it's like we're dying.
Well, and in point of fact, with heart disease being the number one killer of adults in this country, and Dr. Caldwell Esselstyn saying that. Dr. Caldwell Esselstyn saying that heart disease need be nothing more than
it's
a toothless paper tiger.
It's ingrained in my brain. Like it's a foodborne illness.
It is a foodborne illness, and that's where we're at. And I think not all, but a lot of this chronic inflammation is a foodborne illness. Now,
this did not happen 30 years ago.
That's right. And certainly, at least not in the kind of populations that we're seeing it now,
right.
But certainly you may have a genetic predisposition to something.
Right.
For instance, a genetic predisposition to heart disease or to diabetes or whatever. But if you eat the right foods, your risk of any of those things drops dramatically.
Absolutely.
Absolutely. And I say eat the right foods. That also includes not eating the wrong foods.
Well, that's for sure. Yeah. Dr. Metz always told me, he's like, if people don't take the bad out, I'm not going to take my time to help them put the good in.
That's right. So I thank everybody for listening and watching, and I really appreciate it. And we would love to hear feedback. We have multiple ways to contact us.
And they can post on YouTube. This is going to be on any kind of podcast venue, but you can also see it on YouTube if you're listening to this and you think, hey, I'd like to see this too.
Yeah.
Let us know kind of what you're needing to learn more about as well.
Absolutely. We'd love to hear different topics. We've covered a number of topics over the last few months, and we're starting to, I think, want to kind of branch out a little bit, and hearing from our viewers and listeners will help us figure out where you want us to go. So with that, we'll sign off and have a good day.
Take care.
Thank you.